Good afternoon. Thanks for tuning in today. My name is Jeff. I'm going to be taking you through the presentation and getting us started here. With me today is Rohit Joshi and Ingrid Raz. So we'll introduce them in a second. We're going to talk about blocking breaches with SecureMail. This is part 3 of a 3-part series. So we're getting to the end here. And this part, we've really kind of tailored it to what's happening today, how you can protect your clinic from patients that are at increased risk now to viruses infecting their own computers at home while they're working from home, doing increased remote work. And we'll talk about some of the threats that have grown in the last couple of months due to the pandemic. So in the interest of time, we'll get moving through here. So Rohit is the CEO and co-founder of Brightsquid. He's an MSc and a lawyer with an extensive background in privacy law, and has been working in healthcare for a couple decades to make sure that things are compliant for people. Ingrid, also with decades of experience in privacy. She's one of the leading experts in Canada in terms of privacy compliance, so we'll get a lot of good insight from Ingrid as well. We're going to talk about the increase in cybercrime. So unfortunately, with the circumstances that we're all living under, sort of the criminal element is taken advantage of that. So we'll talk about what's happening there and what we can do to recognize and avoid those risks. We'll look at the risks that patients could be causing your clinic in this time. And we'll talk about how to connect safely with your patients to make sure that you're protecting yourself from some of the risks that they may be bringing your way. And then working together to prevent ransomware attacks. We'll talk about, sort of what clinic and staff are saying, clinicians and staff are saying about SecureMail. And then, of course, it's our monthly webinar, so we do have a draw coming up at the end. So just kind of getting started, you can't go very far on the internet these days without seeing anything about how much ransomware is increasing, phishing attacks are going up. So we actually see a 4,000% increase in ransomware emails and phishing attacks in the last couple months. And a lot of things, we read a lot about what's happening with things like Zoom, people breaking into calls, all that sort of things. So there is that unfortunate element with everybody working from home now, and there wasn't any time to train staff about how to be safe. And from what we've seen and what you can read in the news, that is not happening on an ongoing basis anyway. People are just kind of crossing their fingers and hoping that they get through this safely. So we'll talk about what you can do to protect yourself. You can't obviously train all of your patients in cybersecurity, but hopefully you have trained yourself and your staff, and you've got some of the tricks and tools, and we'll talk about how to operate safely there. So we'll get things started. Rohit, if you want to just talk about how email spreads cyber viruses to get us kicked off here.
Yeah, sure. Thanks, Jeff. Listen, I think we who've kind of been watching email for the last 30 years recognize that email was never really created for security. It was created for redundancy. And so the way we create redundancy was that a message would bounce off a number of servers in order to get to its destination. So after a message was created, it would bounce through these servers and get to a destination. The challenge that we've got with email, because that was the construct, is that at any one of those points, it can actually be intercepted, and especially if the security on that server isn't up to speed. And particularly now, I think what we're seeing related to your slide, Jeff, in terms of the increase, is we're seeing that we've got patients working from home, but we also have a lot of health providers working from home and a lot of the staff working from home. So any of those elements that you may have had set up in your office that are typically going to prevent some of these ransomware attacks are no longer can be used. And that presents sort of a compounding factor. And that's where the challenge becomes something that we felt we wanted to talk about. The challenge is that in many times in clinics that we're a part of, and we're in thousands, when we go there, part of the IT team has already set up that infrastructure. They've taken very, very specific approach at making sure that the clinic is as well protected as it can be. Well, that's kind of gone out the window. And one of the things that's happening is that the ransomware hackers, the people that are profiting from this, the cyber criminals, are actually recognizing that now is a very, very good time because we lack, corporate safeguards. So it's not just patience, and certainly none of this is meant as a malicious, chance, right? The patients aren't trying to infect your clinic. It's just that their information, their email is being infected, and that's infecting your clinic or your home setup, and on and on and on, and there it spreads. So next slide. I've probably already jumped through this. Apologize, Jeff. I was talking a little bit through it. Yeah. So again, patients working from home, and your staff working from home, and the other clinicians in your office working from home, increase that risk of ransomware considerably. Next slide.
Yeah.
And so the challenge again here is that when we're looking for safe methods, what we're suggesting here, and something we've spent quite a bit of time thinking about, is how do we offer a product that's going to be safe for the patients, your staff, the clinicians, and everybody who needs to share very, very sensitive data. And because we've got a closed network of information, it doesn't bounce around from server to server. And that allows us to have a great deal of control over making sure that there are no ransomware attacks. This is an interesting stat. The cybersecurity surveys, even in the best of times, 50% of the organizations were not prepared for ransomware. So where we are at now is way less than that, which is a huge challenge.
Ingrid, what do you think of the implications here from a privacy perspective, and the exposure that some clinics might have if they're connected to patients through regular email?
Well, exactly. I mean, the risks are huge because you have to realize that patients aren't as savvy in email use, and they do click on unsafe links. They haven't had the training to know that, oh, here's a link, I'll just click on it. It looks tempting, it looks interesting, I want to learn more. And in turn, it turns out to be ransomware or cybercrime, and then it infects, of course, because they're now connecting with their physician and their clinic. So I feel that the risk is quite huge when patients are utilizing an email from a generic product.
The other thing, Ingrid, that I wanted to talk about is, you and I have spent thousands of hours training clinics to make sure that they're using proper processes.
Yeah.
Well, that's kind of out the window. I'm not sure that, when we get back to normal, if there isn't something here that we need to start talking to all of our providers about how do you work safely from other locations. Maybe you can comment a little bit about that, because I know that you and I have started to have those discussions about what if this is more of a normal? What about the next pandemic?
Well, and that's true. This is our new normal. And this may only end up being 50% of our workload is remote. But the truth is you can't train each and every patient on email use and proper email use. So they don't get the benefit of the training. So the responsibility will come back and lie with the practitioner, with whether it's physician or dentist or whatever, to be able to make sure that their patients are aware of the risks. And that might be something like a poster or an email sent out. Please be aware, here are some risks. But for sure, there needs to be a broader understanding and a training protocol in place so that everybody's aware, including clinics, which will be the new normal.
Totally.
So we'll dive into looking at what you can do, how do you connect safely with your patients. I will point out too, there's a questions tab in the GoToWebinar panel that you're all logged into. So feel free at any time to type your questions in there, and we will do our best to address all the questions. Go ahead, Rob, please.
So I think that we've had some good experience with connecting patients. We've got tens of thousands of patients that use it now, and before long, it'll be hundreds of thousands of patients using our tool. And I think that the reality is that from a clinic's perspective, we want to encourage you to insist. We've got clinics doing it now, saying that the only way that to get a hold of them is through a secure method, because that does protect the clinic. Ingrid, I know that you and we've spent a lot of time trying to understand how to make this as simple a process as possible to get the patients to use it. I'm not sure if you have any thoughts around, consent around this, but clearly there's issues here.
Well, there is issues, but if you realize that, as it states in here, 80% of the patients are not comfortable sharing their personal information and their health information, for sure, through regular email. They're aware that there's risks, they just don't understand them all because nobody's really taken the time to educate. So teaching them the value of sending securely back and forth, and once they're comfortable and understand that it's secure, then they are very happy to use it. They're not as reluctant, and once they have that guarantee it's safe, it absolutely is the way to go for them. That comfort zone is everything, because then now you know you're protected.
Yeah, and I know that you and I have looked at some of the consents that clinics need to get signed off that say, we're going to use email and here's your consent. I mean, it's longer than the consent for medical treatment because the risks are so many. Yeah. And by using a secure system, you don't have to worry about a layer of consent that's as long as 2 pages.
Because well, it's about 4 pages for an email consent just to list all the risks. Yeah.
Yep. And I will point out too that the acceptance rate for invites for patients from SecureMail is actually higher than the clinical acceptance rate. And the feedback that we see from patients that come directly through us is very, very positive and appreciative. You get the odd person that says, I just want to use email, but even I think we have hundreds of patients on the system who are in their 80s and 90s, so it's something that's really easy for people to use. Let's just kind of look at this. Ro, do you want to talk about the structure of SecureMail and how it sort of is different from what we just looked at about the email?
Yeah, and so I think they sort of mentioned this earlier. We decided to take an approach that looks and feels like email, because we knew if we made it look and feel like email, that we wouldn't have to train that many people, right? Because the patients would know how to use it, because most patients know how to use email. The health providers would know how to use it. The staff would know how to use it, because everybody, it's become email's become a tool. But it's not at all email, and I think that's the important bit. Even though it looks and feels like email, it's a closed system. We've identity verified everybody that's on that system. There's no spam. There's only verified users and identity verified people. And so because of that, we know everybody that's logging in. We know when they're logging in that everything in there is secure. We don't have access to that data because of the privacy laws, but the patients and the providers do. They have access to their own data. And so it's the right way to build a network, a secure network. And we're very proud of the work that we've done to get millions of messages moving through the system.
Yeah.
I know that we have a lot to talk about on this, but I think in the rush to market with virtual care, I only want to point out one thing. There was a rush to market. We became very excited about Zoom for healthcare. We became very excited by other systems that allow one-to-one communication between, physicians and other clinicians and their patients. In reality, for organizations that have been doing this for the past 5, 8, 10 years, secure email is actually the foundation, because you want to protect that resource who's sitting on the other end of that virtual call. And by protect them, I mean that's very valuable time for everybody. And so in the process of getting that patient ready for that potential phone call or for that video call, most patients are very used to and comfortable using a system like SecureMail to make sure that that time is being used effectively.
Next slide. It's an interesting stat that I think is surprising to a lot of people. Like you're right, Rod. It's like everybody jumped on. Well, we think video when we think virtual care, but it's actually a very small fraction of reality.
Yeah, and I mean, Ingrid, I'll ask you just before we jump into this. So, I know that in the world of privacy and security, I've been really surprised at the number of systems that have just shown up. And and I know that you and I've had this conversation. If you can lend your hand to that, lend your thought to that.
Well, and a big concern with that is great to jump into the market, but if you haven't conformed, you at a minimum have a privacy impact assessment. As Zoom discovered right off the hop, there's Zoom bombing. Well, apparently there's a privacy setting that people didn't know they had to turn on. So all of these things, they did rush to market, which is great. We needed it. But a lot of these products that have been around had the time over the years to become compliant. And now, of course, we're sitting in a situation like who is compliant, who's not. How do we know what's safe and what's not? So in the underlying thing, if you go with security and privacy first, because when we hit with round 2, let's say, of the pandemic, or even if we don't, but we continue to work virtually, you need to make sure that privacy is in place. It's a huge risk to leave it all out there loosey-goosey. I certainly wouldn't want my health information compromised. Like, be secure, be safe.
Yeah. And I think, like you've said, there was lots of people that wanted to relax the rules, in the sense that we needed to jump to a solution. I've seen that change a lot even in the past 2 weeks, where everyone rushed to market, like I was saying, but now that threat of Zoom bombing, the threat of ransomware, the threat, which actually ultimately doesn't serve the clinician, the clinic, the patient, and so while we applaud the desire to move quickly, we don't need to do it outside of very conformed systems that have gone through the privacy checks.
Right, and just think of this, on top of a pandemic, a privacy breach shuts your office down because you haven't done your homework. I mean, there's just such a huge risk and liability. You just would rather err on the side of safety, go with what you know, and be safe. Now's not the time to experiment.
Yeah. It feels like one of the things that people were experimenting with, because again, there was this rush to try to replace a face-to-face visit with a video visit, and I think just trying to jump to it that quickly, what happened was people forgot that before people come in to actually a face-to-face visit, there's lots of work that's done by the front desk staff to make sure that that patient and the clinician are ready for it. And so one of the things that we have developed years ago was this concept that, first of all, the clinician may not want to be contacted directly, that there's a front desk that really needs to manage patient inquiries, and
identity verification, all of the things that the front desk always does. You scheduling. Now may be circumventing to go right to the video visit, and those things are still required. You can't just assume.
Exactly right. And so what we, in taking kind of a sober second look at this now, of the challenge that we've got in our clinics, the time that's required by the clinician needs to be protected, and having a virtual front desk makes sure that the questions that the patients have are answered. It makes sure that their appointments are properly scheduled. I even know now that the front desk in many of our clinics is going through a test of the video platform, just to make sure that when that patient shows up, that the clinician shows up, that the technology isn't just another barrier. And so we're seeing that a lot now, and that's really the job well designed for that front desk, so that when the clinician is on that video or on that phone, that everything else has been worked out, all the questions have been answered, the questionnaires have been filled in, all of that stuff. And we're seeing more of that. Yeah. Go ahead. The consent, right?
Yeah, and so if you have a virtual office visit, the last thing a custodian or a provider needs is to go through all the steps, and then let's say the patient on the other end is having video problems. That is all resolved at the front desk. This is all taken care of, including the consent, the patient identity. That front desk is actually still critical today as it is in office.
Yeah, exactly. So I would encourage, from a user's perspective to really, think through your current process. As Ingrid has said, there's enough, stress on the system. Let's try to at least mirror the same system remotely or virtually, because if we can get that type of behavior to actually take hold, now we actually have a working system end to end, because it mimics what was working in person 2 months ago.
Yeah, and it comes down to tools as well. I think, we kind of talked about it a little bit, but what are patients familiar with? What are they capable of using? A lot of patients aren't set up at home necessarily to do video consults, or they need that extra bit of support. So, what can you use that's safe and familiar, so that patients can engage and maintain access to care, and you have that ongoing continuity.
Yeah.
So we'll move on, because we do have a couple questions. But I think the point we're getting to is you've got this tool, Secure Mail, and if you don't have it, you certainly go to brightsquid.com, click on the COVID-19 support button on the homepage, and any medical clinic can request a free account, and we will get you set up with that. I think the point is, it's really easy to use. There's no, I don't want to use the word excuse, but there's no reason to have to default to email, to put your clinic at that risk. And you have the ability to help your patients communicate securely with you and protect yourself and protect them. Because the last thing, I think, Ro, you kind of hinted at it, the last thing you want to do is come through this pandemic, this really difficult time as it is, and end up they're now dealing with a privacy breach situation where potentially your clinic is shut down. You're dealing with a different investigation, and we want to make sure that we get through this sort of in one piece as much as we can.
Yeah, and I would say to that, Jeff, just to add to it, the worst thing that could happen is if your clinic, your home, everything gets hit by ransomware, because now you are shut down until you pay the ransom. The second worst thing is, as a part of that, now you also have to declare a privacy breach. Like, that's the other side of just using secure systems that have been, rated for, medical grade, that have gone through the approval processes. So that's our strong urging.
Yep. And I think, it just comes down to, I think you talk to any one of our users and understand how easy it is to use, how beneficial it is in terms of bringing efficiency and improving effectiveness in the clinic. We'll get to a couple of questions now. I think, for starters, there's been talk about a relaxing of privacy regulations. Can you speak to that? Is that a reality?
No, it is not a reality. The commissioner has even come out and said, it doesn't, they can't change the legislation to say, oh, now you don't need a privacy impact assessment. They actually said, you still need one, because you still need to safeguard that information. The rules haven't really changed. The only relaxing is you can do it in a little more condensed version if you can prove the safeguards are in place, and if you can have your agreements in place. And during a pandemic, a lot of these things, companies that are producing, let's say, video chat or anything else, they don't have the time to be dealing with information manager agreements or providing you the technical information to provide in your PIA. So at this point, it's literally better to go with what has gone through all of the due diligence. They have not relaxed the rules.
Yeah. I think then, what about, can you just talk about texting? So we've talked a lot about email. What about texting in this scenario?
Sure. So texting faces the same issue that email does, in the sense that it's unsecure servers that it's bouncing through, and that's just the reality of a text message, and how it passes. And there's lots of other challenges to text, which are, because you don't have to necessarily log in to get it. We've got other problems around identity verification and making sure patients are who they say they are. And I think, Jeff, one of those headlines that you probably shared was the amount now of ransomware that's showing up off of people's texts, and that's showing up on apps that have been downloaded and haven't gone through the final approvals. that looks super interesting. I think early in the pandemic, there was one called COVID-19 tracking.
Yeah.
And that was full of ransomware. And I think, you know, it lends itself to the same problems, just in a different way, with text.
But even verification, as trivial as you get lots of texts coming in with a phone number you can't identify, they're not going to know, oh, you're a practitioner, you're quote unquote safe. And very few people will actually know the practitioner's text number.
Totally.
So they're a lot more apt to push on a link that they think might be from, even if, and some of them even come in titled doctor, you know, whatever. So yeah. I'm just advising caution with texting because it's very risky.
Yeah, you know, I was in a conversation yesterday with a number of doctors and saying that, you know, they don't even have enough phone lines at the clinics to be able to call out. And so they're using their cell phones, but they block the number on the cell phone so they can't be contacted. Well, guess what happens? Most patients won't pick that up.
Exactly.
So it's really a circular challenge. This is again where the front desk comes in and says, okay, at 10 sharp, and it's going to be a number that you can identify, and you know, that's the type of thing that needs to happen ahead of time.
Right, which is an extra layer of confusion and struggle, and you've just complicated your straightforward practice that you've had in place for 20 years.
Totally.
And you know, I get ransomware texted to me on a weekly basis, right? Like I think I've shared one last week. I was watching Netflix and I got a notification from Netflix saying that my account was disabled because of payment, and click this link to go fix it. You know, and if I do that, then does that download into my contacts and then send it out to everybody else through there, right? So, you know, I would caution even further against texting for the same reasons that email is a risk.
Yeah.
So we're getting close to the end here. We have a question.
One last thing, Jeff. You know, it's interesting because there's so many people watching Netflix. That's probably a pretty effective ransomware phish. Right? Wait. I need this more than I need lunch, is to fix my payment because I've got to watch it tonight. So I think, you know, this is again where the smart, you know, hacker is thinking through the behavior of this.
Yep. Well, we just have one question here about do you do teledentistry as well? Can you speak to that?
Yeah, and so there's a number. For sure our product is being used in many dental facilities. We don't offer a video component, but again, we're sort of the front of getting everybody ready for the video. When it comes to video, there's lots of tools on the market that we would be happy to recommend if you send us an email. But we don't specifically endorse one publicly because there's lots of them on the market. All I would say is prior to getting to that video, you need to make sure that patient's ready and that the provider's ready.
Yeah.
Right.
We do have a lot of clinics that.
Oh, sorry. Yeah, they still need consent. They still need to put those aspects in place. So it's not like, you know, you really won't be changing much. And teledentistry is actually becoming popular, especially during this, because you can pre-screen your patients and determine which ones are emergencies.
Yeah, perfect.
So, and then the sort of follow-up question, kind of back to the texting. So the question, like, should we or should we not be texting patients?
Definitely not.
Yeah, and I would say just in the terms of using secure mail for teledentistry, I mean, a lot of clinics, a lot of patients use it to send photos and videos of things that can't be captured at a specific time, right? If there's something going on with them that they you know is episodic, that can't be scheduled, or it's just, hey, here's a picture of something in my tooth, my mouth, whatever, they can send that, and you can sort of do that in advance and address it sort of and be ready to prepare that. So we're getting very close to the end. I want to very quickly go through our winners of the draw. So most secure messages sent on the webinar today is Heather L. So congratulations for that. Most secure mail invites in the last little bit is Elizabeth F. So congratulations, keep those invites going up, build out the network, and we can have sort of get everybody on board with the security and safety that we have. And for showing up today, Evelyn A will win a $25 Amazon gift card. So we'll get those sent out to you this week. Thank you very much for tuning in. If you haven't done so, if you haven't done a PIA recently and we haven't helped you with your privacy support, we can do that. help you get set up with secure mail. Do evaluation on your practice to make sure that all corners of it are operating safely and compliantly. You can do a privacy risk assessment on brightsquid.com. Just go there, fill out, it's a quick 7 questions, and we'll get in touch with one of our onboarding reps to help you sort of identify where you can improve. Any last words before we sign off?
Thanks, everyone. Thanks. We'll look forward to being on the other side of this.
Yep. Great. Thank you so much, everyone. Enjoy the rest of your day.
Bye-bye.
Bye.